Hi everyone, my name is Miss Sam and you can find me in the Wantagh or Farmingville office. I'm back for my last Therapy Tip Tuesday video, and this week I wanted to talk to everyone about AAC. AAC stands for Augmentative and Alternative Communication. So AAC means all of the ways that someone can communicate besides talking. People of all ages can use AAC if they're having trouble with their speech or language skills. Augmentative means to add to someone's speech, and alternative means to use instead of speech. Some people use AAC devices throughout their entire lives, and others may use an AAC device only for a short amount of time, like if they had surgery or they can't talk. There are a lot of different options for AAC, and I am not going to be able to get into all of them today, but I'll talk about some of the broad categories. So some options include no-tech or low-tech options, and this could be gestures or facial expressions. It could be writing, drawing, spelling words and pointing to letters, pointing to photos, pictures, or written words, or even use of sign language. Some high-tech options usually include an iPad that has an app on it, or use of a computer with a voice-generating device. So a lot of people get nervous about AAC because they don't really understand it, or they get nervous that it's going to inhibit one's speech instead of enhance it. So this is actually a myth, and research has shown that AAC can actually help with these concerns. So people who use AAC can also learn how to read and write, which is a pretty cool fact. So I just wanted to talk today also about what we use in our office and some of the ways that I will target our AAC device during our sessions. So we use a tablet with the app Proloquo to Go, and I really like this app because you can personalize it to yourself and really individualize it. It's also awesome because you can switch the users on the app, and if you wanted to make a user for home and then a user for speech as we add things in, that's also a really good option, and what I like to do a lot of the time when first introducing an AAC device to a new user. So typically, this is what it will look like. I'll work on a lot of requesting in the beginning, and I will also work on these different tabs. So we have food that you can go into, and you can add anything that you want. And then you can also have toys and add anything that you want. So it's really, a really great app to use. So I like to target AAC while also, if we're first introducing it, working on colors or having a physical object to help with motivation. So if we're working on colors, I will have the individual present the item to the individual. I will have them request on their iPad and maybe even try for that word approximation on top of tapping on their device, and we're scanning, we're looking, tapping, and then I will give the object to them. I'll also do this, which I know you've seen these before, dot markers if we're coloring and they want to request a certain color. So I'll have them, request using their iPad as well. But that's just a little bit about augmentative and alternative communication.